School of Physiotherapy Associate Dean Dr Cath Smith has begun a study that films dog walkers with chronic health conditions. The study is intended to reveal how exercising a dog affects a person's well-being. Dr Smith is here with the details. Good evening.
Hello.
Tell us a little bit about the study and what you're looking at.
Well, what we're doing is walk-along interviews with people and their dogs at their usual dog walking times. And we're trying to gather more information about some of the health benefits, but also perhaps some of the drawbacks for people walking their dogs.
Now, I understand that there's a helmet camera involved. Do tell.
Well, the helmet camera allows us to capture more information than sitting down and talking to somebody would do. So we can capture information, we can look at how people interact with their dogs and with their environment and with other people that they meet along the path, so with their community. In a previous study, we'd use a handheld camera and had quite a few problems with shaky recordings and very, very curious dogs who just wanted to come up and see what the videographer was doing. So the head-mounted cameras have, so far, they've seemed to omit some of those problems.
Now, do you just drive around the streets looking for people out walking their dogs, or is it actually scheduled?
We do schedule them, but we really try and stick to the person's usual walk, the time of day, so we have some very early starts and some late nights too. The video cameras don't work too well in the dark. But yeah, and we advertise, but it's mostly through word of mouth that we gain our participants.
Now, why did you decide to do this study?
Well, for a number of reasons. I'm part of a research team at the School of Physiotherapy and the Department of Psychology, and we've been working for quite a while to look at ways that encourage people with chronic health conditions to do more exercise, to do exercise that's fun. One of those studies, we interviewed some men with multiple sclerosis, and we found that over half of the participants walked their dog as their main form of exercise, and if they didn't have a dog, they wouldn't do any exercise. I've also met some wonderful people and their dogs who've given me descriptions about the many different ways that dogs can help them.
Now, you've done studies using or involving dogs before. Why the special interest?
Look, I'm a dog enthusiast, I guess. I'm trying to be an objective researcher and look at the negative sides of dog walking and dog ownership as well as the positives. But that's probably the main reason.
There's been previous research in this area. What has that found?
Most of the research is really around the benefits. I think that most researchers who look into this area are dog enthusiasts, and there's not really very much out there about the drawbacks of dog walking and dog ownership. And also there's not very much out there that's been done with people with chronic conditions, with chronic health conditions. So my anecdotal experience, I've heard a lot about how dogs can help people with chronic conditions, so I just wanted to make it a little bit more official and do more investigation.
Are there any drawbacks?
There are a few. Last year we did a similar study with healthy adults, and going for the walk-along interviews, you really pick on some of the drawbacks. For example, if dogs go missing or if they get a little bit grumpy around other dogs, it can be stressful and can kind of cause a little bit of social isolation as well.
What do you think some of the possible practical applications might be of the research?
Well, I think in the initial instance it's to raise more awareness of just how dogs can contribute, and especially that special contribution that dogs can make to people living with chronic health conditions where they're often isolated and often very stressed. Healthcare professionals, I think, need to be more aware of how we can support people with chronic conditions in exercise. I'm not saying that we prescribe dogs or write a prescription for dogs at this stage, but if we know a little bit more about the drawbacks, then we can help people to make an informed choice and perhaps help them to set up practical things like dog walking networks for when their condition stops them from going walkies.
School of Physiotherapy Associate Dean Dr Cath Smith, thank you so much for your time.
Thank you.